Welcome to today's topic. I'm Dr. John Bartemus, and today we're going to answer a common question that I receive when discussing whether or not a person wants to partner with me on an action plan to address their health challenges. And that question is, how long will it take for me to get better, feel better, see improvement? And my answer to that question is I honestly have no idea on a person-to-person basis. The key paradigmatic difference in functional medicine is that every person is a unique individual and has their own unique biochemistry and physiology, and they have their own unique contributing factors and layers involved in causing their health challenge or health challenges. So I cannot pretend to know, even if a person has the same diagnosis as another person, how each of them will respond, because all of those factors are different. What I can say is that there are four possibilities in how someone will respond. In functional medicine and in my practice, the way we track response in a person is subjectively or symptomatically what the person is feeling, complaining of, experiencing, the thing that brought them in the door. And then we also track them objectively with objective markers that you can test and retest and see change, and those are commonly exam findings and most commonly lab findings. So there are four ways that a patient can respond in combination subjectively or symptomatically and objectively or on labs. And so I'm going to lay those out for you today. And if you're watching this on YouTube, you can see the graphic that I'm going to draw out for you. If you're listening to this on a podcast, then I encourage you to head over to my YouTube channel and check out this video so that you can see these graphics. So the first possibility in a way that a patient or person can respond to care is that they will improve symptomatically or subjectively faster than they improve objectively or on the labs. So this person typically is not upset with this response because, hey, they're feeling better and they happen to be feeling better at a higher rate than, or at a faster rate than the labs are changing. And so, hey, no big deal. Let's continue with implementation of the action plan and see how quickly we reach that clinical goal. The second possibility is that a person responds great subjectively or symptomatically, and they respond equally as great on the labs or objectively. So this person is responding equally symptomatically and on the labs. So again, no complaints there at all. That is the holy grail, or that's the person that everyone wants to work with. They get better at the same rate that their labs change. The third option is that a person has improvement on the labs or objectively before they feel it subjectively. So that means that you may get to a retest point in an action plan and see that your labs are changing, but at least in my practice I also send along a progress evaluation at each retest time so I can evaluate subjectively how is the person doing in their care. So this instance would result as the subjective report or the progress evaluation that the person filled out would say, I'm not really noticing much of a difference. I feel the same pain or same complaint that I came in with, not really noticing a difference, and I'm a little frustrated. But on the labs, they're improving. And so this is important to sit down and go over the labs with the person and say, hey, hang in there, you're doing a great job. I know that you're implementing the action plan as directed because we are seeing objective changes on the labs, and you just happen to be the person whose objective markers or labs change ahead of your symptoms. But hang in there. We want to continue implementing as recommended. We want to continue building momentum because the symptom changes will come. So trust the process and keep stacking great days together. And then the last potential response is that the person isn't changing subjectively or symptomatically, and the labs also are not changing. Obviously, this is the response that both practitioner and and person do not want to experience, because then we have to really dig down deep and say, what is contributing to the non-change here? First, we would say, from a clinician's perspective, I would say, all right, are we addressing the lowest common denominator? Are we addressing the cause? In terms of asking the person, I would say, have you been able to implement the plan? Are you implementing the plan as recommended and consistently? And if not, what can we do to get you to implement that plan as recommended and consistently? Because it takes momentum to move from a state of dis-ease or sickness or disease toward a state of optimal. And if we never start, or we don't stack enough days together, then we're never going to get there. So this last situation is one that doesn't typically show up in my experience, because the people I work with are committed to starting and implementing and moving forward. So if this were to show up, which I hope it never does, we would have to dive into those questions and dig deeper and figure out what's going on. So the real answer to the question, how long till I feel better, the real answer is I don't know. But the three options, assuming that you're going to implement the recommendations, are you either feel better ahead of your labs changing, your labs change and your symptoms change at the same time. That's the best option. Or your labs change ahead of the symptoms changing, and that would be perceived as, I guess, the worst option, even though you're going to change. So remember that everyone is an individual, everyone changes at a different pace, everyone has different contributing factors to their health challenges, and everyone responds different to different treatments. So just because one person, or just because I have a certain dose recommendation in the action plan, doesn't mean that a given individual can even make it to that dose. Some people make it to that dose no problem, don't notice any symptoms or side effects. Some people can only go halfway to that dose and they start to notice side effects, so they have to scale back down. And that doesn't mean that that person can't utilize that treatment, but it just means they have to utilize a smaller dose and go a little bit slower with that treatment, so that may cause response time to be a little bit longer. So if you are frustrated with care, or you get to a point where you're frustrated with care, then reach out to your clinician and speak with them, and hopefully they're checking both subjective and symptom change and objective lab changes, so you could both sit down and say, okay, here's where you are symptomatically, and I know you're frustrated maybe and not feeling that you're where you should be with the amount of effort you've been putting in, but look, here you are on the labs, and these labs clearly indicate that you are making significant positive change towards our clinical goal of optimal health. And so keep pushing, keep stacking good days together, and let's make these tweaks maybe as indicated by the labs, and soon you'll be feeling better to match your labs.